What if your chest pain is not just stress or acidity, but a warning from your heart? Angina is one of the most important symptoms of heart disease. Millions of people experience it, yet many do not understand what it really means. You must be wondering why I am referring to angina as angina. That is because we were wrongly taught angina pectoris, whereas the correct pronunciation as is angina. In simple terms, angina occurs when the heart muscle does not get enough oxygen-rich blood. In this video, we will explore what angina is, the different types of angina, and some lesser known forms related to blood vessel blockages in the abdomen and microcirculation. Coming to what is angina, angina is not a disease itself. It is a symptom that usually indicates reduced blood flow to the heart muscle. This reduced blood flow usually happens when the coronary arteries become narrowed or temporarily constricted. As a result, the heart muscle does not receive enough oxygen, especially during physical activity or emotional stress. People experiencing angina often describe it as pressure or squeezing in the chest, pain spreading to the arms, jaw, shoulder, or back, shortness of breath, or fatigue. Now let us look at the different types of angina. Type 1 Angina pectoris. Angina pectoris is the classic and most common form of angina. It usually occurs when the heart works harder than usual, such as during exercise, walking, running. The pain typically lasts a few minutes and improves with rest or medications like nitrates. It is usually caused by narrowing of the arteries. Type 2 Angina Decubitus. Angina Decubitus occurs when a patient is lying down. When we lie flat, more blood returns to the heart, increasing its workload. In people with weakened heart circulation, this extra demand can trigger chest pain. Patients often wake up at night with discomfort and may need to sit or stand to relieve the symptoms. Type 3 is Prinzmetal's angina, also called variant angina. Unlike typical angina caused by artery blockages, this type happens due to temporary spasm in the coronary arteries. These spasms suddenly narrow the artery, resulting in decreased blood flow to the heart. It often occurs at rest, especially during the night or early morning. On an ECG, it may show temporary ST segment elevation, similar to a heart attack. However, it usually responds well to medications such as nitrates and calcium channel blockers, which relax the arteries. Type 4 are angina equivalents. Sometimes angina does not present as chest pain at all. These cases are called angina equivalents. Instead of chest pain, patients may experience shortness of breath, extreme fatigue, nausea, sweating, dizziness. This is particularly common in elderly patients and in people with diabetes. Type 5 is abdominal angina. You must be wondering what it has to do with angina pectoris. Angina can also affect organs outside the heart. Abdominal angina, also called intestinal angina, occurs when there is reduced blood supply to the digestive systems. This usually happens due to blockage in major abdominal arteries such as the superior mesenteric artery, the inferior mesenteric artery. The patients typically feel severe pain in the abdomen after eating because digestion requires increased blood flow to the intestines. Over time, patients may avoid eating because of the pain, which can lead to significant weight loss. Type 6 is microvascular angina. This is another important type of angina, also known as cardiac syndrome X. In this condition, the smallest blood vessels of the heart do not function properly, even though the major coronary arteries may appear normal. The microcirculation cannot supply adequate blood to the heart muscle. Patients often experience chest pain, fatigue, reduced exercise tolerance. This condition is more commonly seen in women and can be challenging to diagnosis. Angina is the body's warning signal that the heart or other organs may not be receiving enough blood. We discussed several important forms, including angina pectoris, angina decubitus, Prinzmetal's angina, angina equivalents, abdominal angina, microvascular angina. Understanding these types helps doctors diagnose cardiovascular problems early and begin proper treatment. If you or someone you know experiences persistent chest pain or unexplained discomfort, it is important to seek medical evaluation. Your heart sends signals when you sometimes when something is wrong. The key is to listen before it becomes an emergency. To get to know about various heart diseases and how to protect yourself from them, subscribe to my channel and hit the bell icon, as I do not want you to miss this valuable content